Hello, everybody. We are back now with a truly incredible milestone. St. Francis Hospital celebrating its 1,000th procedure using an ion system that allows early detection of lung cancer in patients, significantly reducing the time from detection to diagnosis to treatment.
So important. And joining us now in studio to talk more about this really incredible achievement is Dr. Anil McGee, the Director of Interventional Pulmonology at St. Francis Hospital. Thank you for being here. This is exciting for so many folks out there that, might not even realize they're at risk for lung cancer.
I appreciate you guys having me today. It's truly an honor.
Now, people out there hear lung cancer and they go, smoker. Not the case.
Correct. There's actually a lot more younger and non-smokers being diagnosed with lung cancer. We don't really know exactly why, but there could be some genetic factors into that and also some environmental factors.
So you're part of this cutting-edge thoracic oncology program. What is that? How are you really making a difference in diagnosing lung cancer?
Sure. At Trinity Health in New England, specifically at St. Francis, we truly work as a team of doctors. So it's not just myself, but there's a thoracic surgeon, a radiation oncologist, an oncologist, so a lung cancer specialist. And we work as a team when we evaluate patients with abnormal CAT scan findings. So if a patient presents to us with an abnormal finding, typically a spot in the lung, and they typically have risk factors like smoking, we then have to further evaluate that, typically with the biopsy. So that's where I come in.
Okay.
And what robotic bronchoscopy is, it's a relatively new technology that was brought into hospitals about 10 years ago, and we're able to utilize their CAT scan, create a GPS map to that spot, and then navigate through the mouth all the way down into the lungs, through the airways to that spot and take biopsies.
Wow. So this is like areas that were unreachable before. So this new technology is really allowing you a different view.
You got it. So those difficult to get to spots in the lung that are hard to get and they're small, the goal is to be able to biopsy those spots accurately, but most importantly, safely for the patient. And we do that at St. Francis.
An ion endoluminal system. Did I say that right?
You got it. So it's a robotic bronchoscopy platform, which I utilize here right in Hartford to navigate to these hard-to-get spaces of the lung and biopsy those nodules.
I mean, 10 years ago, would you think about,
No, we made... country has made significant strides in improving the diagnosis of lung cancer, which is really important for our patients.
That's
and
so
you,
wonderful.
We're going to toot your horn a little bit. You are one of the top single users of this across the country. St. Francis just completed its 1,000th ion procedure, which is a huge milestone. So if people are listening and they're worried about something, do they need a referral, or how do they know that? How do you know if you need this or could benefit from it?
Yeah, great question. I think the first thing is you talk to your primary care physician about if you have any concerns of lung nodules or lung issues. They often then get referred to myself as a lung doctor or my colleagues who specialize in this, and we can evaluate you if you need a bronchoscopy for that. For that spot. But not all patients need procedures.
Doc, how do the symptoms present themselves?
If the spot is small in the lung and we're worried about lung cancer, unfortunately don't have symptoms. So that's where if there's a screening program, which we have one at St. Francis, patients that are smokers, that have smoked 1 pack per day for at least 20 years, they're between the ages of 50 and 80 years old.
Okay.
They're a current smoker or have quit within the past 15 years, they qualify for a low-dose CAT scan to assess their lungs if they have any at-risk spots in the lung. And if they do, then we can act on that.
Wow.
That's absolutely terrific.
I mean, so great that the technology is really helping amazing doctors like you advance and help people faster.
Yeah, I think the one thing I would say, yes, I'm the doc and part of this, but we have a great team at St. Francis. So it's myself, the surgeons, the nursing staff, the respiratory therapists, the radiation technologists that we work with. We all work as a team to take care of the patient, which is the most important.
Do they all dress as snappy as you do?
They do. Probably
Okay.
even better.
Just want to make sure. Good to see you. Thank you so much.
Thank you,
Nice
Doctor,
meeting you
for
both.
being here.
Nice meeting you both.
Yeah, and for more information on this minimally invasive lung biopsy option at Trinity Health of New England, all you have to do is visit trinityhealthofne.org/ion. And you can also follow along on Facebook, Instagram, and LinkedIn right at St. Francis CT.